Dr. Rowe here, and today we're going to talk about the difference between stress versus anxiety. I am an integrative and pediatric mental health expert who's on a mission to change the way we view and treat children's mental health. If you're new to my channel, hit subscribe and turn on your notifications so you get my videos every week. Let's dive in. Many people think stress and anxiety are the same, but guess what? They're not. Stress really is quite different. We all experience stress, and we all experience what we call life stressors. Stress happens in episodic periods or short sprints, right? So you get stressed because there's a big storm and a tree fell on your car. That's pretty stressful, right? That's about as stressful as you get. Then there's little annoyances. Anybody who knows me knows my top annoyance is those people driving in the passing lane. I'm not sure why you're driving in the passing lane going the speed limit. It's called the passing lane. Those are life stressors, right? But anxiety is different. Anxiety occurs over a long time, at least 6 months. It's chronic. It's something that really interferes with your life. Most people who experience anxiety experience worried, looping thoughts. I call it kind of not being able to get off the worry train, right? Where you can't stop this worry that comes over you. Anxiety doesn't have to be rational. A situational stressor doesn't have to occur, even though that could be the start of it, right? So that tree that fell on your car and all of a sudden a bunch of other terrible things happened, or that was just very triggering for you. So there's not a lot of rational basis to these worried thoughts, but they hijack our thinking. And they often really interfere with everything from learning, right? If you're a kid or you're an adult, can interfere with work, certainly interferes with relationships. And I think one of the biggest things that people misunderstand about both stress and anxiety is that you can have high levels and be very functional. We often think of people with clinical anxiety as people who are kind of just sitting in a corner, withdrawn, not really functioning. Yes, that can happen. But the majority of people with clinical anxiety are living lives. They're going to work. They may be a straight-A student. Remember, the age of onset of an anxiety disorder is age 6. That's the average age, which means the symptoms in anxiety disorder often start a lot sooner. And as we talked about in our other video, what we know about anxiety is that it often shows up in physical ways, very much so for children, because they can't articulate what they're feeling, but also for adults. There are different types of anxiety disorders, and they're categorized based on the type of anxiety that you have. You could have social anxiety, you can have generalized anxiety, you can have medically induced anxiety. I work with a lot of people with Lyme disease and PANS and PANDAS, and these can be people who had no history of any mental health issue, but given that they had typically an infection disease in the case of PANS and PANDAS, but can be other things, and certainly with Lyme, with the onset of a tick-borne illness, can have a lot of dramatic symptoms and almost always anxiety, because it's at least at a minimum long-term chronic stress. So long-term chronic stress can lead to an anxiety disorder. Our brains and our bodies are not designed to have long-term chronic stress, even though we think we can handle it, right? And our body knows no difference between good and bad stress, right? Anybody who knows me knows I have like super fun, exciting things going on. I wrote 4 books in the time of COVID and did a lot of other things. I call it my Corona creative period. But I had to make sure that every day that I was using tools like neurofeedback and biofeedback and PMF. I meditate every day. I am very conscientious about my health. I'm a paleo eater, and I always exercise every day in some way, shape, or form. And it's just part of my lifestyle. And why do I do that? Not just for overall health, but for my mental health. It's really important because, again, your body knows no difference between good or bad stress, and we're not designed for chronic stress. And if you have stressors, a lot of stressors in our lives, and we do, you can be feeling clinical anxiety. My Dr. Rowe is that you believe that chronic stress can't lead to an anxiety disorder. That's just not the case. Chronic stress can cause our nervous system to get in a hyperactive state, and all of our resources will go to that stressor in our system, including our immune system, all our brain power, lots of learning power can be wasted, attention. And so chronic stress is a deterrent to both physical and mental health. My Dr. Row Go is to incorporate those daily tools into your life to manage your stress. Remember, we can take just as little as 10 minutes can make a clinical difference. 40 straight days of meditation for more than 10 minutes has been clinically proven to change our brain functioning. That's it. Anybody can meditate. You maybe think you can't, but you can. These are great tools. Exercise, diet, adjusting your life so you can sleep. These are all effective tools to regulate our nervous system. And my big Dr. Row Go is getting help when you need it. So, in my book, The Teletherapy Toolkit for Therapists, we know that teletherapy is as effective as in-person therapy. So there's no more barriers to getting help. There's lots of therapists all over the United States. You can find a licensed therapist online. You can check with your insurance. You can go to places like Psychology Today. You can even Google. Just find a therapist that fits with you and has experience in your clinical issue. So remember, if you or a child you care about is struggling, it's going to be okay. I am here to show you how to help children and teens become alert and feel good about themselves. I want to hear how you're dealing with your chronic stress or anxiety in your life. So drop all the healthy ways you're managing in the comments. Catch the next episode, and remember, subscribe to the Dr. Roseanne channel where we talk about natural and effective ways to reverse children's mental health issues.